Welcome back. I'm Dr. Cheek and I'm a licensed clinical psychologist. And today we're going to talk a little bit about cognitive behavioral therapy. And I'm going to discuss many aspects of cognitive behavioral therapy, like the elements of the treatment, some of the third wave approaches to the treatment. And I want to kind of answer the question of, does cognitive behavioral therapy, or CBT for short, rightfully has a bad reputation? Because there have been some criticisms of cognitive behavioral therapy. But first, let's kind of define what is cognitive behavioral therapy. In most cases, cognitive behavioral therapy is a manualized, structured, and brief treatment that's focused on identifying patterns of problematic thinking or distorted ways of thinking and identifying how those distorted ways of thinking influence how we behave and how we feel about our internal and external environment. And the premise for cognitive behavioral therapy is understanding the interactions between our behaviors, our thoughts, and our emotions, and how they influence how we see our internal and external environments, with the goal of introducing change in one or all of those areas in order for us to have a better engagement with our internal and external environment. Now, there are some therapies that we consider third wave approaches to cognitive behavioral therapy that are less controversial. And those are therapies such as acceptance and commitment therapy, or ACT, dialectical behavioral therapy, DBT, and mindfulness-based cognitive therapy. Those seem to be less controversial and seem to receive less criticism than the traditional forms of cognitive behavioral therapy. Now, there are three primary elements associated with traditional cognitive behavioral therapy. Now, that first element is being able to manage the symptoms associated with the mental health concern. So that's focused on things such as coping, relaxation strategies, mindfulness strategies. And the goal for that particular element is learning ways of managing our symptoms so it doesn't feel as intense as they do when you first start to feel those symptoms. So starting to manage those symptoms so they do not disrupt your day-to-day experiences. Another element of cognitive behavioral therapy is symptom elimination or symptom reduction. And that's done through methods such as exposure therapy, problem solving, behavior activation, any type of skills building training that's focused on learning how to eliminate the symptoms that are associated with a mental health condition or disorder. And that can include things like role playing as well, with the ultimate goal of eliminating or reducing the likelihood of the symptoms that you're experiencing. And that last one, which is the most controversial aspect of cognitive behavioral therapy, is cognitive restructuring or reframing. And that's focused on identifying the problematic patterns of thinking that we may have or thought distortions that we're presenting, learning how to challenge those thought perceptions, and coming up with an alternative thought that does not evoke the same level of emotional distress as the original thought. Now, what makes this particular aspect of cognitive behavioral therapy so controversial is that a lot of individuals or some clients have noted that when they engage in this particular area of treatment, they feel like they're either gaslighting themselves or lying to themselves, or they feel like the therapist is trying to put a positive, overly positive spin on a negative situation. And that's not the goal. That may be what some individuals experience in that process, but that is not the goal. The goal for cognitive restructuring and cognitive reframing is that you are able to identify facts over assumptions or opinions or feelings, and being able to identify when the thoughts that you're having is actually based on the facts of a situation as opposed to the thought being based on an assumption or an opinion or a feeling. And the goal in that moment is to start to identify, like, what thoughts am I having that are based on assumptions, and how do I challenge that? And we challenge that by looking at the facts of a situation that maybe support or goes against that thought you're having, and then being able to come up with an alternative response that takes into consideration the facts of the situation. The goal is to look for thoughts that are aligning with how you're feeling and how you're thinking, that are based in facts, that does not evoke that same level of intense negative emotions. That's the primary goal. And it's not so that you can lie to yourself. Now, if you ever feel like you're lying to yourself, I want to encourage you to have that conversation with your therapist. Now, I've done another longer video focused on that thought process, and I'll put that video around here somewhere. So when we actually go through the process of cognitive restructuring, what we're trying to highlight is what are the facts of the situation? And does this thought that you're having represent the facts of a situation or the reality of a situation? Reality is not subjective. Reality is the fact of what's happening in that current environment. And that is not something that needs to be cognitively reframed. That's not something that needs to be challenged. That's not something that needs to be able to find an alternative to. Those are thoughts that we need to process or deal with a little bit differently. And that doesn't always mean that the thought is going to be positive. So that goes into that second criticism, or the idea that we're wanting to put a positive spin on a negative situation. Sometimes the alternative thought is not a necessarily holistically positive thought. We're wanting to formulate a new thought that can be positive or neutral, with the goal of it not creating those same intense negative emotions. Now, can the alternative thought cause you to have some negative emotions? Yes, but the alternative thought does not cause the intense level of a negative emotion. So your frustration is not at a 10 with the new thought. Your frustration may be at a 2. That is the goal. The goal is not for you to put a positive spin on something negative. The goal is not for you to test your reality of a situation. Now, are there flaws that are associated with cognitive behavioral therapy? There are some flaws that are associated with cognitive behavioral therapy. One of the main flaws that I find that's associated with cognitive behavioral therapy and most manualized treatments is that the treatment itself is manualized. And the problem is not necessarily with cognitive behavioral therapy. The problem itself is with the manualized treatment. And what I find that happens sometimes with manualized treatments is that sometimes some clinicians may struggle with being able to personalize this manualized treatment to the person that's sitting in front of them. And I personally have never found or never run into a client that is a textbook case of a manualized treatment. And in most cases, what I'm able to do, or what I try to do, is to make sure that I personalize the manual to the individual that's sitting in front of me. And that's personalizing the manual to the individual that's sitting in front of me while maintaining the fidelity to the treatment protocol and the fidelity to the manual. And some clinicians may struggle in this area because they have a hard time being able to relate the manual to the person instead of the person to the manual. And that can start to make a client, when you relate the person to the manual, feel like they are detached from that particular therapy. The therapy is not actually focused on them or their particular situation, or the therapist does not understand what they are experiencing. But then there's also the flaw of, and it's a flaw in that it's an aspect that people are looking for in therapy that's not a part of the cognitive behavioral therapy process and the protocol, because it is a brief and structured treatment. So that second flaw is that some clients come in looking for traditional talk therapy, and traditional talk therapy where you go in and you explore in depth past experiences or current experiences and starting to talk through what the situation was and processing the thoughts of that situation or past experiences and going into that in a very detailed process. And that's not a part of cognitive behavioral therapy. Now, is an understanding of your current stressors and your current situations and maybe how their past has influenced those current stresses and current situations associated? Yes, there is an aspect of being able to understand what's happening for you now, understand the role that past experiences plays in what's happening for you now, and using that to inform how we see the symptoms that are presenting, and using that to inform how we determine what treatment is necessary in order to alleviate those symptoms. But in CBT, there is no deep dive into what you're experiencing currently, and there is no deep dive into what you've experienced in the past. And when I say deep dive, I mean processing the thoughts, the experiences, the emotions around all of those things that you experienced in the past, or even processing the thoughts, the emotions, and the experiences about everything you're experiencing currently. CBT is not a traditional talk therapy in that you're not going into grave details about those experiences. We're looking for certain aspects of those experiences that inform how you're presenting today, and being able to address how those past experiences influence how you're presenting today. And for some clients, that's not what they're looking for. So again, as a client, I encourage you that if you go into a therapy session and a therapist is wanting to offer you cognitive behavioral therapy for whatever reason, and you know for yourself personally, you do not like structured treatments that do not focus or go into a deep dive in past or current experiences, then cognitive behavioral therapy may not be the therapy for you. And sometimes we have to understand that about ourselves, which leads me to my next point, which is that cognitive behavioral therapy is not for every client. Every client is not a suitable person to engage in cognitive behavioral therapy. Also, cognitive behavioral therapy is not appropriate for every mental health concern. Although I am a behaviorist and I do enjoy and do like cognitive behavioral therapy, I am very clear that cognitive behavioral therapy is not for everyone, and not everyone would benefit from going through a cognitive behavioral therapy protocol. But what I hope you take from this video is this. Cognitive behavioral therapy is a structured, in most cases manualized, brief treatment that focuses on identifying how you're thinking, how you're feeling, and how you're behaving, how it interacts with one another, where there needs to be change, implementing those changes so we can better engage with our internal and external environment. That's the gist of cognitive behavioral therapy. Cognitive behavioral therapy does not explore in depth past negative experiences. It does not explore in depth current negative experiences. It's focused on symptom management, symptom reduction and elimination, and it's focused on being able to identify problematic ways of thinking and being able to change or challenge those problematic patterns of thinking. And it's gained popularity over the years because cognitive behavioral therapy is one of those treatments that can have a time frame on it. So it's structured. There's a time limit. It's in most cases manualized. It's in most cases measurements based, but also because it's standardized and manualized, it can be tested over and over again for its evidence-based potential. And it has been tested multiple times for evidence-based practices. And it has been shown to be effective for multiple mental health concerns. But like I said before, cognitive behavioral therapy is not for every client. And if you know yourself that you do not like cognitive behavioral therapy, be willing to have that conversation with your therapist. As always, I hope you take something helpful from today's conversation. I hope you've learned something from today's video. As always, please jot down any thoughts, questions, or comments you have below. I thank you for taking the time to listen, and I'll be seeing you again very soon. Thank you.